Did you know that January is National Cervical Cancer Awareness Month? According to the American Cancer Society, approximately 14,000 women are diagnosed each year. 4,000 of those women, unfortunately, do not survive this disease. But what is interesting is that cervical cancer is actually one of the most preventable types of cancer among women. So, what is cervical cancer? Cervical cancer is cancer of the cervix, which is the lower part of the uterus. And it's usually caused by a virus called the human papillomavirus. We call it HPV for short. So, cervical cancer is unfortunately asymptomatic in the early stages, meaning that there are no symptoms. That is why it's very important as women that we screen to make sure that we are healthy. Now, in the later stages, you will see signs and symptoms such as bleeding in between periods, also having bleeding after sexual intercourse, with any kind of pain during sexual intercourse or after. Also, chronic back pain is a symptom, or if you have like a foul smelling discharge. Again, these are all signs and symptoms. Does that mean that having any one of these equals having cervical cancer? No. It just means that if you notice any of these changes, any of these indicators, make sure that you contact your primary care provider or your OBGYN to where they will do further assessment. But the overall idea is that as women, we should be advocates and we should watch out for these signs and symptoms. The good news is that cervical cancer is preventable if detected early. It's treatable. So what can we do to ensure this? By getting a pap smear. A pap smear is a quick screening that is done with your primary care provider or your OBGYN in your office. And it's when they take a swab and swab your cervix. They take samples to the lab to assess for any abnormal cells. Recommendation by the American Cancer Society is that any woman from the age, starting at the age of 21 through the age of 30, should have a pap smear every 3 years. Then after 30 years, you move on to every 5 years. Now, this can vary depending on the results of your pap smear. There's also the HPV vaccine, which is recommended by the American Gynecological Society, that preteens are eligible for, boys and girls, and it is a vaccine that has been shown to prevent 90% of cervical cancer cases. For more information, you can visit the American Cancer Society website, www.cancer.org. I will provide it in the description below. And also, you can visit the National Cervical Cancer Coalition, www.nccc-online.org. They have a lot of information on cancer, and especially with Cervical Cancer Awareness Month, if you're looking for a place in your area that will provide you with a free pap smear or low cost, they do have a resource on the website that when you put in your area or your state, your vicinity, it will show you what areas you can go to get a free pap smear or low cost. So now you know. Thank you for watching. This is Nurse Nana. Until next time. And remember, you are in charge of your health.